Our initiative in applying for the Value-Based Healthcare Award is to help reduce the massive burden of postoperative delirium through personalized prevention. We have an incredible multidisciplinary team founded by Nayeli Schmutz, an anesthesiologist, Ben Dosworth, a cell biologist, PhD graduate from Oxford in pathology who worked at Roche and Pfizer, and myself, a serial entrepreneur with one successful exit so far. We also have an amazing team supporting us and advisory board and international partners.
Postoperative delirium affects 20% of patients over the age of 60 undergoing surgery. It has serious negative outcomes. It affects 59 million people every year. 38% continue with a long-term cognitive decline, and it increases nursing home admissions sixfold. And the only solution we've so far found is preventive. But preventive measures take too much time and cost too much money to roll out to every single patient. So our solution is a pre-operative risk assessment software that calculates the individual risk score of a patient before surgery, allowing for personalized treatment of that patient and preventive actions to be taken for those at risk.
We classify patients in different risk categories: low, medium, high, very high. Depending on the risk category, we can offer the patient different preventive measures. It's always incremental. For the low risk, you don't do anything, you do business as usual. For the medium risk, you observe them closely and try to find early sign of delirium. The high risk will get directly some nursing preventions. And for the very high, they will be followed by geriatrician before the surgery and after the surgery. Before the surgery, the patients can be seen by a geriatrician to adapt all his medication, or they can get something called pre-habilitations to prepare them for the surgery. During the surgery, we will monitor his temperature, his blood pressure, his level of sleep, all these parameters that we will try to keep as normal as possible. And after the surgery, the patient will get what we call non-pharmacological multi-component intervention. It's a bundle of nursing treatment, which are extremely time-consuming, but can decrease massively the risk of delirium. And finally, when the patients get home, the goal is not to let him on his own, but to follow him a few months after the surgery to see how he goes. There will be some benefit for all the people involved. For the patients, of course, we will improve their outcomes. We will decrease the post-traumatic stress disorder that delirium can lead to, and we will allow them to understand their own risk during the surgery.